The Fort St. John Hospital Residential Care Project is a $297.9 million public-private partnership, or a P3 project. It entails 123-bed residential care facilities and also a 55-bed acute care hospital.
This is a beautiful facility. It's a new facility. It's very unusual for us to be able to build something from scratch and to design into it all of the best practices we know about delivering quality care for people who live in this community. I think incredible detail has been thought through in terms of how they've designed this building. It will be wonderful for patients and our staff.
The very basic aspects of community is health, education, wellness, and just the ability to have quality of life. Having a new hospital facility in Fort St. John is recognition that we're a growing community and we're a community that can provide a quality of life to our residents.
It's on a beautiful site and a developing part of a developing city, so it's a beautiful new hospital designed for efficiency, and it's very impressive.
I've been involved right from the start of construction right straight through to now, and it's been just great watching the progress, and it's going to serve us well for the future of the citizens of North Peace.
Well, yeah, I've been here for a few decades, and I think it means an awful lot to the community, and not just a hospital, but the care unit that's attached. It's the first of its kind in British Columbia. Northern Health and the company that's building the hospital is going to maintain it for 30 years. Fully involved the staff from the hospital, the doctors, the nurses. They've changed things in different places to adapt to what those people that work in here have said, and I think that's great cooperation, and that's the way it should be done.
This is very exciting. This is exciting no matter where you live, because it's going to give us an opportunity to have more professionals coming in and more training happening in this hospital that will benefit every community in this region.
Pretty much everything is going to be new and upgraded. The highlighted areas are the OR, operating room, which is really state-of-the-art equipment, high-end stuff, and the surgeons are very excited about that.
I think this hospital, I'm actually very proud of this hospital. This is the 6th hospital that I've built under a P3 process, and I actually do think this is the best designed hospital we have actually achieved.
You could see all the way along that it was a very productive relationship, and when you have a productive relationship, usually the result is more than excellent. And that's what I thought was interesting about this project, is seeing how everyone worked together. And you know, it was pointed out to me that this is the first facility that will be opening so quickly after just completing their milestone of substantial completion. So that is another milestone that this team in the North has reached in a very, very quick time, and as a result we'll be able to serve people quicker. very good tour, comprehensive, and it's a lovely hospital. It's a privilege to be here.
I'm actually quite impressed. It's really open and lots of lighting, a lot of new stuff in here. It reminds me actually being in the big city.
I think for us it's the birthing center.
Yeah.
We have another little one that's due July 5th. So pretty excited to be in the new center there.
Probably the biggest thing in residential care now is each of the resident bedrooms have a gantry lift over the bed and over a significant portion of the room, so that when they want to be transferred to bed or out of bed, we can use the ceiling lift to help them do that.
It excites me that we're going to have very modern acute care inpatient unit. We've never experienced, a full bathroom for each of our patients to use. That excites me a great deal. So what excites me the most is this is going to be an awesome facility for our patients and for our staff.
We're going to be on the leading edge in terms of rural northern medicine and have an excellent facility to be able to provide those services through.
We've actually designed it so that if we grow as a community quicker than we had projected, we have capacity to expand the building without a huge disruption to the rest of the building. So for instance, we know that Fort St. John is busy making babies, and if that continues to grow on the same rate it's been growing, maternity's on the outside edge of the building so that we could expand it outwards. I'm really looking forward to opening day and sharing this building with the community.
The Fort St. John Hospital Residential Care Project is a $297.9 million public-private partnership, or a P3 project. It entails 123-bed residential care facilities and also a 55-bed acute care hospital.